In our other episode, we talked about vasectomy, we talked about abdomen, and a lot of comments were everywhere about vasectomy. People were complaining that, oh, why would I ask me to do vasectomy? Oh, vasectomy is take up manhood. On today's episode, we have a very top public health speaker, Dr. Uchenna, for him to come and explain, give us breakdown bit by bit on if vasectomy is actually necessary or people should just go back to using condoms. So now back to Dr. Uchenna. Thank you so much for coming on the
Yeah,
show. I
thank you.
really
Thank
appreciate
you.
you with your busy schedule. You took out time to come on our show.
Yeah, thank you for the opportunity to be here.
Yeah. So, like, I don't know, vasectomy is a very controversial topic. Like, the last time we talked about vasectomy here on the show, a lot of people were complaining that, oh, why should men do vasectomy? Funny enough, women were like, oh, men should do vasectomy. So we're saying men should use condom. And there was a funny comment that someone said, oh, why should I use condom when I'm married? So I want you now to like break it down in a very simple terms what vasectomy is.
Okay, thank you very much. So first of all, I'm talking to you and to the audience. I'm sure right now, as you're watching this video, you're probably thinking, what is vasectomy? A lot of you don't even know what vasectomy is. All right. And I'm very grateful for a shoot like this, a podcast like this, all right, where we can enlighten you on what vasectomy truly is about. All right. So first and foremost, you have to understand that vasectomy isn't removal of your manhood. All right. No one is touching your manhood. No one is touching your penis when we talk about vasectomy. All right. It's a very, in simple terms, vasectomy just simply means male contraception. All right. It's the way of stopping, males from partaking in achieving pregnancy with a woman. That's what vasectomy simply is about. All right. So, but then to go in depth into what it is, I'm going to like just give you a brief summary of how vasectomy works. First of all, it's a surgical procedure. All right. It's done in the theater. All right. So before in the past, how vasectomy used to be done is that they will cut, hole on the two sides of your, I'm going to try as much as possible to not use medical jargons. All right. But they will cut holes at the two sides of your scrotum, aka your balls. All right. So they will cut the hole at the sides, and there's a tube, a special tube. All right. I don't think I need to bother you with the name. It's a special tube that connects where sperm is produced up to where that sperm is going to, be released. All right. So basically what vasectomy is about is, that special tube, we're basically either tying it or cutting it out completely. All right. So it requires special access. Now, no one does the cutting of the balls anymore. All you need to do is just create a small hole. All right. You create a small hole, access the tube. All right. Just for those of you that might care to know, the tube is called vas deferens. All right. VAS and then deferens. So you cut the tube and, you render the semen spermless, because semen and sperm are different. All right. Semen is what you release, but then semen contains sperm. All right. So now by doing vasectomy, we're cutting off the supply of sperm, making the semen kind of useless as regards achieving pregnancy. So that's really a summary of what vasectomy is all about.
Wow.
Yeah.
So now, also on that last comment, someone was saying it's better for us to use condoms than for someone to do vasectomy. So now I want to know now between condoms and vasectomy, which one is more effective to prevent pregnancy?
Oh, the answer to this question, it's very, very simple. All right. I know many of you might not agree with the answer I'm about to give now, but if we're talking about effectiveness, vasectomy is the most effective. All right. Vasectomy, if I'm going to give you values, 99, more than 99% effective as opposed to condoms. All right. So why do I say, why I'm going to tell you why I think or why I believe vasectomy is more effective. All right. So basically, condom or the effectiveness of condom depends on how you use it. And Believe me when I say a lot of people do not know how to use condom. All right, if I bring condom for you now and tell you, show me how to use it, you will not be able to use it. So a lot of people don't know how to use condom. You're the baddest guy in your class or in your friend group. But when someone gives you condom, you don't even know how to open it properly, position it well. I'm not blaming you for that. It's just how it is. All right. So, by doing vasectomy, you're canceling out that user error that comes with using condoms. All right. And another reason why vasectomy is more effective is because it's more permanent. All right. Stopping you're stopping it at the source. All right. So, like I explained earlier, sperm is produced. So I'm basically stopping the sperm from coming out in the first place. But then condom is just barrier method. If something happens to the condom, if there's a spillage or breakage of that condom, my guy, you're going to be preparing to buy what they call it,
Pampers.
milk or pampers very very soon. So it's very simple and straightforward. Vasectomy more effective.
So now you talked about at the beginning. You talked about vaccination being the contraceptive for men. Now, for men and women, who is the best spot to say, okay, take the responsibility of family planning. So why are you going to say, okay, men take responsibility, women? Like, is it if you're going to choose now, like why are you going to choose, okay, take responsibility of family planning?
The thing is, I'm sure as you ask this question, a lot of you already have the answers in your head. All right. But as a medical practitioner, I think I'm more enlightened in such a way that I don't give, yes or no answers anyhow. All right. So I can't really tell you that it's the man or it's the woman. So to answer your question, it would need communication between the two people involved. All right, but because if we're talking vasectomy, there are some pros and cons associated with it. If we're talking female contraceptive, that's the pills, the copper IUD, that's the one you put inside the woman's vagina up to the womb to stop pregnancy. All right, all those things come with their advantages, their disadvantages, their side effects. All right, so to know who should truly bear the grunt of contraception, it would require both the man and the woman coming together. First of all, you both need to be enlightened on, each method, everything about the method. You talk about it, all right? If I take pills, there's a potential that I'm going to gain weight. Am I okay with that? If I do vasectomy, what if later on I want to have children? All right. So these are things you talk about, you factor them in and then you decide who should bear the grunt. All right. But then I stand here today or I sit here today to tell you that it's no one's sole responsibility. Contraception is both the man and the woman's responsibility.
So now, based on like the let's say based on the like side effects of family planning for men and women, if you are going to give your analysis now, is there anybody that should take the responsibility of family planning, either man or woman, based on your assessment that okay, this IUD has a side effect, vasectomy has this side effect. Would you advise medically the person should take the responsibility of family planning?
Okay, medically, I would, now that you put it this way, I would advise the man I would advise the man to take the responsibility. I know it's a very funny answer, but yes, I would advise the man to take the
So you're
responsibility.
advising men to call their manhood.
No. I remember I explained earlier that vasectomy is not cutting your manhood. All right. And besides, vasectomy is not the only means of contraception.
So you will do vasectomy.
I can't decide now. I mean, okay, right now I wouldn't. I'm still young. I want kids. Right now, I'm 100% sure that I'm not going to do
So
vasectomy.
like later on in life now, as you're advising us now, will you do vasectomy?
Later on in life, yes, it's something I can do.
No, not you can do. Is this something you will do?
Not really. I haven't really. No, I haven't really thought about it. No, if I'm being completely honest, it's not something I've thought about. I don't think. There's different stages for things. All right, a baby is not going to be thinking about how to make money. The same way
Yeah,
someone my
true,
age
true.
isn't going to be thinking about whether I'm going to have a vasectomy later on in life. I mean, if I get to that point, I'm telling you, it's something I could do. All right. Yeah.
Right. So, but now this particular issue now, I see some people saying it's going to affect sexual performance. Is that true?
No, no, it's not. All right. So, I'm sure you're probably tired of hearing me say this, but vasectomy is just simply cutting the tube, all right, that transports the sperm to where it will be released. All right. So, what there's a hormone, all right, there's something in your body that is responsible for your libido, sexual drive, and all that. And that hormone is called testosterone. You've probably heard about it.
Yeah.
All right. So it's a steroid based hormone. All right. And where this hormone comes from is something called adrenal gland. This gland is on top of your kidney. All right. So that's where this hormone comes from. So as long as there's nothing wrong with that gland, or as long as there's nothing wrong with your brain, all right, it's a whole mechanism of how the brain plays a role in making sure that that hormone is released. As long as there's nothing wrong with these two things, all right, sexual function remains the same, libido remains the same, sexual development also remains the same. Yeah.
So now I want to also talk about vasectomy. Is there any fear or any risk that men should look out for? Or if anyone wants to get to decide to vasectomy now today, is there any like risk factor they should look out for?
Okay, so like I said earlier, vasectomy is it's a surgical procedure. All right. So like every other surgical procedure, there are some side effects. I believe you're talking about the side effects. All right. So you know, when you're having a surgery, the side effects that you should, be aware of. I mean, your doctors will probably enlighten you about them before, you sign the whole surgery papers and all that. All right. So you should be aware of, potential pain after the surgery. All right. After vasectomy, you might have, slight pain for like 2, 3 days. All right. Nothing too severe. All right. There might be bleeding. All right. These are just normal side effects. All right. But then I also want to tell you that, the side effects of this surgical procedure are minimized to the barest minimum, depending on the skill, all right, of the surgeon, or depending on how clean the theater is and all that. So you reduce the side effects of this surgery. All right. So another fear that you should look out for is after doing this vasectomy, what if I want to have children later on? I get to the age of 65, I do vasectomy because I have 2 kids, and somehow the 2 kids die. All right. And then I realize, okay, I want to have more children to, inherit everything I have. After doing vasectomy, you wouldn't be able to have children. It's permanent. All right. So, I mean, I heard that it's reversible in some cases. All right. But it's mostly permanent. So that's a fear you have to factor in while, coming about that decision of whether or not you want to do a vasectomy.
So now, let's go back to using of condom. Is there any like for the to use condom for a very long time, like the long uses of condom, is there like a side effects on it?
Okay, yeah. So I'll come to the one that everybody knows. All right. So a lot of people who use condom for a long time, they get to the point where they're like, the sex is no longer sweet. All right. So condom has a way of desensitizing your penis. All right. So that's one side effect. All right. Another side effect has to do with the material the condom is made of. All right. So there's latex based condom. So if you are allergic to latex, all right, so you could have the symptoms that come with allergy, maybe itchiness or bruises and all that. So these are the two most important side effects that come with prolonged condom use.
So you're going to advise me to do vasectomy because of it.
If you don't have plans to have kids, yes, I would advise you to do vasectomy rather than using condoms. Another thing is condom has a very high failure rate. all right? And it depends on human usage. Like I said, if you don't use it properly, problem. If it breaks, problem. If it slips off, problem. All right. So at the end, it has a lot of a lot of cons, and I can't really count so many cons for vasectomy. So yeah, I think if you don't have plans to have children later on in life, yeah, you definitely should do a vasectomy.
Oh, nice. So now, we're in Africa, we're in Nigeria now. So, there's a cultural stigma with vasectomy in Africa as a whole. So, if you think that if the stigma is not there, you think people will want to do vasectomy?
Yeah, I believe so. I think majority of the problem we have is, the information that people have about vasectomy. So, I mean, if we're able to enlighten people on everything we've basically just talked about now, if we're able to enlighten people more, I believe that it might not eliminate it completely, all right? Because when there's a stereotype of this sort, it's very hard to eliminate it completely. But then it's going to give room for, a situation where men are more open for counseling. All right. So men are going to be more open to, hearing about this vasectomy thing. All right. And, hearing about the effects and whether or not they would want it for themselves. It's also going to make them to consider it early. All right. Like, I'm sure now someone that is watching this video is probably thinking, after hearing everything we've said now, is this something I would want to do later on in life? All right. So that's what something, a conversation like this can help with. It might not eliminate it completely, but it does a whole lot of good as regards, making sure that people don't think that vasectomy is cutting off of the manhood.
Um, so now, for apart from cutting off of the manhood for vasectomy, is there any biggest minds that you've had about vasectomy?
Oh yeah, a lot,
Can you give us
a lot. All right. So I'll go back to the first question you asked. Does it reduce sexual performance? That's number one. All right. A lot of people believe that it reduces sexual performance and all that. All right. Another fear people have is the mentality of if I remove a part of my penis, it's going to make me less manly. All right. And then for those of them that are married, they're like, my wife is suddenly going to now be bigger than me because she knows I removed, a part of my penis. I'm no longer a man. I'm no longer in charge. It's all this African stereotype. And then the worst of it all is just, a lot of people don't know what vasectomy is. So you just heard you get this thing where people they do where they will remove one this thing from their penis. Be like say the name na vasectomy. Omo, they normal to do. That's it. Like that is it. And everyone just goes by that and it becomes a whole thing.
Yeah.
Just by that single statement, they normal to do. All right. So these are the fears people have as regards vasectomy. Another fear is, surgery. For those who are not victims of the whole libido or unmanliness stereotype, for those who are not victims of that one, a fear they could have is the surgery. All right. Nigerians fear surgery a lot. All right. So that's something that could make someone not want to do a vasectomy.
Oh. So now, if I'm going to advise men now, like men that love their wife, and comparing with the IUDs and other contraceptives, are you going to advise, like, is there any advice you give men that, okay, if you love your wife, do vasectomy, if you see your wife, like, is there any general advice you give men on vasectomy?
Yeah, there's particularly no general advice. All right. But if I'm talking about me, all right, if I get to that point, or when I get to that point where I'm with my wife and we're done with kids, personally, I feel like I would take on the responsibility of contraception because the ones that women use come with a lot of side effects. All right, especially the pills comes with a lot of side effects. First of all, the pills, all right, for some people, it can make them to gain weight. It can, depression. It can cause depression in some of them. It can cause menstrual irregularity, like someone who normally bleeds for 4 days, you're bleeding for 7 and all that, or your cycle is 28 days and all of a sudden it's increased or reduced. So these are the side effects as regards pill. Then as regards that one that you put inside the vagina to the womb, if an unskilled person does it, it can lead to infection inside there. Yeah, it can lead to infection. And moreover, some women can be allergic to the material that they use to make that thing. All right. Example, copper. You might be allergic to it, and then that's a problem. All right. But then there's little to no side effects as well, as regards vasectomy. Yeah. And condoms. So I think I would advise the men there. I mean, personally, I'm not in the position to advise anyone, all right, but personally, I would, bear that responsibility.
Thank you so much, Doctor,
Yeah.
for coming on the show. Like, personally, I've learned a lot. Now, they put condom and vasectomy on one side. See? I don't know
No,
what I want to choose.
I'm not gonna tell you which one to choose, but
Me too,
yeah,
I don't even know what I want to choose now. Like you
yeah,
said, I'll take your
yeah, it's
advice.
something you think about,
Think about it when
yeah,
I get there. Like, don't get to the bridge.
yeah, you cross
We'll
it.
cross it. Thank you so much, Dr. Uchenna, for coming on the show. I so much appreciate you.
Yeah,
And thank you to our viewers. If you've watched up to this moment, please wait for what we're doing here. Please subscribe, like, and share this video and help someone that have a very bad stereotype about accepting. See you in our next episode. Bye.